So, Doctor, one more question before going to the end. I'm having some two questions with me. How can someone detect cancer earlier, and what are the key symptoms to watch for, Doctor?
So some of the cancers we can detect early. That's the good part, and those we call screening testing. For example, for colon cancer, you have a great screening testing called colonoscopy. If you're
Yeah.
45-year-old and above, you must get colonoscopy every 10 years. We know because we can detect the small polyps before it becomes cancer. And then the gastroenterologist will take those polyps out and then it will not become cancer. Let's say we detect a very early stage 1 cancer. All you need is a surgery, done with it. So colonoscopy is a good tool for colon cancer detection. And for lung cancer, if you are a heavy smoker, then we do a low dose CT scan of the lungs once a year to look for any small nodules in the lung and see if it is cancer or not. And for breast cancer, we got great technique called mammography or mammogram, and women can get the mammograms 40 years and above. But if you have a strong family history of breast cancer, you may have to get the mammogram even sooner. So you got great tests there. And the research is going on to even do blood tests to detect cancer. Even there are some blood tests we could do. They're not perfect yet, and they're not available everywhere. But there are some blood tests that can detect early cancers.
Okay. So, doctor, means as how dangerous is cancer, doctor? It means the stages. If someone means got know about the in stage two, so is he means in the means danger zone, or it's he might be more worried about that, or it can be cured also.
So, first of all, we need to figure out what cancer it is. So, stage 2 lung cancer is different from a stage 2 breast.
Hi, doctor.
Hey,
Yeah. So you can go. Sorry for the inconvenience, doctor.
sure.
I think due to some issues with the Instagram itself, only it's get disconnected.
Oh, okay. So, I think you asked the question about stage 2,
Yeah,
is it
yeah,
bad?
yeah,
So,
doctor.
it's not. Stage 2 cancer is curable. If we, well, no matter what cancer type it is, we could say there's a high chance of cure for stage 2 lung cancer or stage 2 breast cancer. So there's a great hope for stage 2, even stage 3 cancers. Even for stage 4, as we talked before, right? Depending on what type of stage 4 cancer you have. And with advanced treatment options now, stage 4 patients are living years and years. So
Yeah,
talk to the oncologist before you simply say, hey, I'm not going to get any treatment for my stage 4. Go talk to them. You may have a great options. If you don't want chemo, you cannot tolerate chemo, you may have an immunotherapy or a chemo pill that you could take.
yeah. Yeah. So actually, why doctor? I'm asking because I have seen many people's those who are means worried about those stages, because when they go for means when they consult the doctor, and in the return they get you will have a chemotherapy. So what they imagine due to the films and all, that they will have a hair loss, they will have this type of issues. So for that means people are not going to treat cancer as well.
Yeah, some chemos do take your hair out, but the good news is it's going to come back. It's not a permanent hair loss, right? But not every chemo has the same side effect. Some chemos don't affect the hair at all. I have, 80-year-olds, 70-year-olds getting chemotherapy, they still have their hair in. So depending on what type of cancer, what type of chemo, and you have options to choose from. Luckily, we have more than one option to use for most of the cancers. So that's when the doctor and the patient has to sit together, draw the plan. Hey, this is your stage 3 cancer. This is the chemo option you have. But if you don't want this based on the side effects profile and the benefit ratio, let's do part B, like the plan B. So they have to talk to the doctor and decide what is best for that particular patient compared to a different patient. What do we call personalized treatment or personalized medicine? One treatment doesn't fit to another patient. So it have to personalize to that particular patient and that particular cancer.
Yeah, doctor. So that brings us to the end of the today session, doctor.
Thank you for
Means
having me.
you thank to you, doctor, for sharing your such valuable insights and to give time from your busy schedules.
Thank you so much.
Yeah, doctor. I will means inform my audience. If you found this session helpful, please share it with your friends, families. If you still have a question or need a second opinion, you can contact with our doctor through our website www.myamericandoctor.com, and do follow us on Instagram, Facebook, as well as on YouTube. We will be hosting more live sessions soon, so make sure to follow us and stay updated. Until till then, take care, stay informed, and we will see you in our next time in our next session of Ask My Doctor.
Thank you. Bye
Thank
bye.
you, doctor. Thanks everyone.